This video that I'm about to make is for the general public, both for my professional colleagues and for the people, like ordinary people, right? So, please, if you are diabetic, you know that you are diabetic. You are either on insulin or on oral hypoglycemic agents or medications, especially if you are on insulin. But whichever one, please make sure that before you take your insulin or before you take those oral hypoglycemic agents, make sure that you check your blood sugar level. Make sure that you prick yourself and check your blood sugar level with your device. And if you don't have the device, please go and get it. Go and buy it. Or you can even go to the pharmacy store or anywhere that you know that they can help you to check it. Please go there and do it before you take your medicine. Because if you don't do that, there's tendency that you go into a hypoglycemic coma when you take your insulin without checking it. This is for those that can give themselves their insulin, those that can inject themselves their insulin. If you don't check your blood sugar level, there's tendency that you go into a severe hypoglycemic coma, which is very, very bad. Because there is a situation now, and unfortunately, the patient is late. I am making this video for educational purposes. Let me state that before I go on. We come here to say it for people to learn. Also for the so-called healthcare professionals. Let me use that word so-called. Sorry about that. But for us also to learn, because the person that precipitated this situation, the person that caused this situation was a nurse. I don't know whether it's a registered nurse, whether it's a qualified nurse, I don't know. But the person that did this was a nurse. It was reported that a nurse came to this person's house and gave this person insulin. Now, we don't know if the nurse checked the blood sugar level, but this person presented with a hypoglycemia, severe one, 29 milligram per dl. When the person presented, this person was already in a coma state. So that is to tell you that if this nurse had checked the blood sugar level, she would have seen that the blood sugar level was okay. There's no need for the insulin, and she wouldn't have given this insulin. But apparently she didn't check. So she went ahead to administer the insulin, leaving this person. And who knows, probably after the insulin, there was no food as well. Maybe this person has already eaten, and then she came and decided to still give the insulin. No prior checkup, nothing. So if you are also a healthcare professional, whether you are a nurse or whether you are qualified or you are a Lisa or you are 19 girl, whichever one you are, please and please, before you give anybody insulin, make sure that you check the blood sugar level. Make sure that the food is already there. Not that the food is coming. Make sure that as you are giving the insulin, the food, you are looking at the food. What you have to do is just to tell the person, oh yeah, within 15 minutes time or within 30 minutes time, please take your food. And the kind of insulin that we have in this our environment is usually the rapid acting insulin. That's the one that is mostly and commonly prescribed. So you can't just give it to this person without food available, without making sure that this person have not eaten and there is food already on site. So before you give, please make sure that the food is there. It's not that the food is coming. It's not that I will go and buy food. No. This is for the nurses and also for the individual that is taking their insulin by themselves. Don't say that, oh, I will go and get food or I will go and prepare food. No, the food is already prepared. In fact, you have dished it out. Let it be there. Then you take the insulin and then you wait for 15 to 30 minutes and then you can have your meal. That is how it is being done. That is what you should do. If not, the person is going into hypoglycemia coma. Like you're going into coma if care is not taken. Please share this video. You don't know who you might be helping. And if you are a nurse that is just starting out or you are just starting on your career and you don't have information, you don't know these things, like you don't know it, please ask questions. Make sure that before you take that home care job, before you take that home care gig, make sure that you are well equipped, not just your materials or anything, but you up here, that you know the rationales, you know the outcome, and you know what to do. I had once declined a home care gig, and it was also a diabetic patient, because these people are very their situation, their condition is critical. I looked at the parameters, I looked at the factors in place, and I realized that I can't meet up, because you have to administer it at the same time. If it is morning, it should be morning. It's not something that is going to be in the morning, you go and administer it by afternoon, or when the patient has already eaten. The only time you can give insulin is when the blood sugar level is above 250 without food. That's the only time you can give insulin without food, that when this patient is in obvious hyperglycemic state, then you can use the insulin to bring that. And even if you have given the insulin, you keep on monitoring, close monitoring, to make sure that this patient is not going into hypoglycemia again. So this is not just a condition that you just come and give injection and then you leave. That's what we tell you, that nursing is beyond giving injection or anything. You have to know what you are doing, and then you have to do it very well. Please share this video.